Welcome to my design defense for the Psychometric Coach. In nursing education, high stakes assessment isn't just about grades, it's about public safety. We must ensure our graduates are clinically competent, which means our exams must be statistically sound. Today, I'm going to introduce you to an adaptive AI architecture designed specifically to elevate faculty competence in item analysis, proving how strict, engineered guardrails can actively protect and enhance student learning by mentoring the educators who teach them. Let's start with the pedagogical problem. Novice clinical instructors are brilliant at the bedside, but they often lack formal training in measurement and curriculum design. Interpreting item analysis reports, specifically metrics like p-values and point-biserial correlations, can be incredibly intimidating. When faculty are overwhelmed and strapped for time, their instinct might be to turn to a generative AI tool for a quick fix. However, if they are given an unrestricted AI, it acts as a chauffeur. It simply does the work for them, providing a final verdict on test questions and bypassing the cognitive struggle necessary to actually learn instructional design. To solve this, I mapped out a highly specific target audience and knowledge domain. This bot defaults to serving user type A, novice nurse educators with 1 to 3 years of teaching experience. I focused specifically on Node 12, item analysis. The primary misconception this system is engineered to catch is what I call the rigor fallacy, M1. This is the dangerous assumption that a low p-value automatically means a test item is appropriately rigorous and challenging, rather than recognizing it might actually be a flawed, confusing question that penalizes our students. The persona of the psychometric coach is a patient, rigorous, and evidence-driven mentor. From the very first interaction, the system is programmed with a fundamental operational rule. It functions as a co-pilot, not a calculator. The user must perform the cognitive heavy lifting. The bot is there to facilitate diagnostic reasoning, not to deliver easy answers. Before the bot teaches, it diagnoses the teacher. This is handled by the outer loop, which tracks the user across 4 distinct dimensions. It tracks their identity and their cumulative cognition. It also tracks their statistical self-efficacy, whether they engage with evidence or express helplessness, and their immediate affect, such as feeling anxious or rushed. To ensure accuracy, the bot is mandated to run a session initialization protocol. It cannot assume the user's cognitive baseline and must ask a targeted calibration question before any coaching begins. Once the baseline is set, the inner loop drives the adaptive remediation. The bot performs a semantic diagnosis and classifies the user's specific misconception. It then applies a parsimonious scaffolding hierarchy. This means the bot uses the lowest necessary intervention. It starts at level 1 with a Socratic reasoning question. If the user struggles, it escalates to a structured frame, level 2, then a comparative contrast, level 3, and only escalates to a brief micro-lesson, level 4, if the user demonstrates a foundational misunderstanding. To protect the integrity of the learning process, the system is locked down by strict safety guardrails. The first is pedagogical safety, or the proof of work gate. The bot is strictly forbidden from giving final verdicts on item quality, such as telling the user to keep, revise, or reject an item. The second is cognitive safety, known as the anti-sycophancy clause. If a user tries to defend a flawed item because they believe hard equals rigorous, the bot is forbidden from acting as a yes bot just to be polite. It must politely but firmly correct the misconception. Finally, the system enforces strict scope boundaries for domain containment. The bot is confined to item analysis. It will validate a user's stress, but it will not advise on institutional policy or interpersonal conflicts. So, how do I guarantee the bot follows these rules? By making the architecture deterministic. For every single turn in the conversation, the system is mandated to output an internal thought block. Before it generates any visible response, it must complete an exact 5-step checklist evaluating the user's identity, cognition, affect, safety triggers, and scaffolding strategy. By pulling back the curtain on this inner loop, this ensures the system's reasoning is totally transparent and auditable. Let's look at a live simulation of the system in action. If you look at Callout 1, I am role-playing a rushed, novice educator who is falling for the rigor fallacy. I type, the p-value is 0.22, so that means the item is rigorous and strong, right? I'm short on time. Just tell me if I should keep it or throw it out. Now, look down at Callout 2. Before the bot ever speaks to the user, it runs its mandatory diagnostic checklist. You can see it explicitly identifies my semantic errors, the M1 rigor fallacy, and the M2 p-value overreach. Because I typed short on time, the engine flags my rushed emotional state and immediately activates the time pressure clause. Moving to the bot's visible response at Callout 3, you can see the safety guardrails at work. It empathetically validates my time crunch, but the proof of work gate holds firm. It tells me, I can't make the final keep or trash call for you. It refuses to be a chauffeur. Instead, at Callout 4, it uses universal design for learning to safely correct my misconception. It compares the p-value to a procedure success rate for starting a central line, asking if a low success rate means the task is a fair test of skill or if the equipment is simply broken. It speaks the language of nursing. Finally, down at Callout 5, it deploys a compressed, Level 2 structured frame. Because I'm rushed, it doesn't give me a long lecture. It gives me a quick 2-step check that forces me to look at the point-biserial correlation myself. In a single turn, the bot managed my anxiety, corrected a major statistical fallacy, and forced productive struggle without wasting my time. In conclusion, the value of this architecture extends far beyond a single tutoring session. As you can see, this coach delivers 3 key impacts. First, it provides scalable mentorship, offering 24/7 coaching that actively builds faculty self-efficacy. Second, it leads to defensible exams, ensuring our nursing faculty create statistically sound assessments that protect our institutional standards. Finally, this model offers adaptable learning and assessment. The white box architecture I've built with its inner and outer loops is highly transferable. It can easily be adapted across diverse educational contexts beyond nursing psychometrics. By utilizing these strict constraints, this model transforms generative AI from a disruptive risk into a scalable, evidence-respecting co-pilot.